had been honest, and I think that's a very significant fact. He hasn't answered any of the litany of questions which have been raised by the SNP, by the Labour MPs. He hasn't got into any of those detailed issues. For example, the sending of patients from hospitals to care homes, an issue which, of course, has caused such grave concern in Scotland. Now, he sort of swept it away and said, look, the government in England worked with the government in Scotland, and we were working together to increase testing. That's about as far as he's gone. And I think you're quite right to say it does, of course, raise very serious questions still about his competence, and it was quite significant that he just didn't get into any of the details. So I think you're right to say a lot of those questions are still hanging over Matt Hancock.
Yeah, and of course there was a 7-hour testimony from Dominic Cummings yesterday, so an awful lot of content and a lot of accusations to answer. I mean, what do you feel are the biggest ones which still haven't been addressed?
Well, clearly the whole question of the shielding. I mean, they were supposed to have put a shield of protection around care homes, and we know that clearly was an area where thousands across the country, thousands of elderly people who were discharged from hospital have died in care homes subsequently. Clearly, there is a massive failure there, because care home proprietors across the country are coming forward and saying that they believe that they were lied to. So that's, I think, one of the very key areas where he could potentially be in trouble. It's all going to depend, Hayley, on whether or not Dominic Cummings produces any of the sort of evidence he claims he has to substantiate these things. Now, this is exactly what Jeremy Hunt, the chair of the Select Health Committee, pointed out, that, look, we need some evidence. And I think the whole point of it is the difficulty for, I think, Labour and for the SNP is that at the moment the government are just brushing it aside. We've had the Prime Minister coming out. He's on a visit to Essex, and he's been saying that all of this commentary is just unsubstantiated. It doesn't have any relation to reality, and the government are going to get away with that. The other key issue, you see, is the question of whether or not we're going to get this inquiry. Now, that was a point the SNP put repeatedly. Will there be an inquiry? Why isn't it starting now? And it was quite significant. Again, Matt Hancock stood very clearly behind the line of the Prime Minister that there is not going to be an inquiry. It will not start until 1922, he said. And I thought it was quite significant that Matt Hancock was pointing very much to this being an inquiry on the lessons that will be learned for handling a future pandemic, rather than the blame game, which I think many people feel should be the result of that inquiry. And it's very much as though the focus is going to be on the future rather than laying blame for the past.
Yeah, I think you meant 2022 there, Nick.
2022, I did. I'm so sorry. Did I jump ahead a bit?
You went back a bit, but don't worry.
No, I definitely meant 2022. Yeah. I mean, the whole point is that they wanted, of course, it to start now.
Yes.
And he was saying, look, we are learning the lessons as we go along. That is the way to do it. And he very much made the point that he was working in unison on that very point with the Scottish Government, which will be interesting to see whether that in fact is true.
Indeed. And Matt Hancock repeatedly, seems to point to the success of the COVID vaccination, both here and abroad, and the fact that the Oxford AstraZeneca, was the first really to be licensed. I mean, has this particular fact, and is this a tactic really which he's relying on to see him through this?
Very much so. The point is that he's making the point repeatedly that the country has risen to this unprecedented challenge in an unprecedented way. You're right about the donations of the AstraZeneca jab. 450 million of them have now been jabbed. People have been jabbed using the Oxford vaccination, their vaccination. And of course, on the other very key point, you're quite right. They're talking about the success success of the vaccination program, and holding up Bolton, which of course has had this great peak of cases of the Indian variant, pointing out that 90% of the people who've ended up in hospital there are people who haven't been jabbed. And they're saying, the government is saying, this points to the success of the vaccination program. Now, when it came to the sort of other killer question as to whether or not the relaxations in England will all go ahead from June the 21st, he was adamant that nothing had really knocked that off course, that the sense was that they would still make that assessment by June the 14th. But I think you're quite right. There's no doubt about it. This was an easy ride for Matt Hancock. The tactic was just to ignore everything that Dominic Cummings had said, and just to say, well, look, he's a destructive force. We can ignore him. That won't be the case for much longer, I think, if Cummings produces any evidence.
OK, Nick, good to talk to you. Thank you very much indeed. The veteran political journalist, Nick Jones.
Now, France has become the latest European country to introduce restrictions on UK tourists due to the spread of the Indian coronavirus variant. The French government announced that from the 31st of May, anyone arriving from the UK must quarantine for 7 days. Well, let's speak to our reporter in France, Sarah Canals. So, Sarah, in terms of the timing of this, we've had the Indian variant for a little while now. Why has this been brought in?
Well, I believe this is because France is being extremely cautious right now. It has been just 1 week since terraces, museums, and movie theaters reopened after almost 7 months being completely shut down. Figures have been drastically improving here in the country. The vaccine rollout continues to accelerate. So France wants to protect the country from mutation. Actually, the UK joins a list of 15 countries that since the end of April, beginning of May, are required to do a 10-day quarantine. Now it's 7 days for the UK. Countries such as Brazil, India, Chile, South Africa, for instance. But actually, the decision announced yesterday by the Elysee spokesperson comes also as a blow for France. Let's remember that around 30 million British travelers visit France every year, more than any other nationality. And France is actually eager to reactivate tourism and boost its economy. Last week, the French Parliament approved a sort of national sanitary pass to attend big events, a pass that will be in sync with the one that the EU is currently drafting in order to travel. So it also comes as a blow here for France. But cautious would be the main reason.
Yeah, what are coronavirus cases like in France at the moment, and do you not have already variants of concern?
Well, the question here is, will the Indian variant dominate France? For now, around 80 cases of the Indian variant have been registered in the French territory. The dominant variant here is still the English one, which represents around 80% of contagions. We also have the Brazilian and South African ones that represent only a 6%. So this is why France is actually being extremely cautious. And when it comes to figures, they are actually improving a lot. The curve of new contagions has significantly decreased in the last week. France registered 12,000 new cases in the last 24 hours, while last